Today, I'm providing a developmental history on a 30-year-old African-American female client based on an interview that I conducted with her on February 11th, 2020 at 1 p.m. I have organized my findings from the interview into 4 sections. Section 1 focuses on the history of her pregnancy. Section 2 focuses on her interpartum period history. Section 3 focuses on her delivery and immediate post-delivery period. And Section 4 focuses on her child's developmental milestones. The child in this developmental history was the client's second child. Early during the pregnancy, the client had a high blood sugar reading that revealed that she had developed gestational diabetes, for which she was required to get monthly glucose tests for the duration of her pregnancy. The client endorsed a high sugar cereal intake during her pregnancy and was already obese before becoming pregnant. The client had regular ultrasounds, the results of which revealed nothing unusual about the fetus except the gender could not be assigned with certainty until 2 weeks prior to delivery. The client denied taking medications or any exposures to substances during the pregnancy. She also denied having any substance abuse history. The client delivered the child at full term via C-section because the fetus was too big to turn into the proper position before delivery. No intrapartum complications occurred. The child, assigned female at birth, weighed 7 pounds and 15 ounces upon delivery and had an APGAR score of 8. The client and the child were monitored in the hospital for 4 days following delivery to make sure the anesthesia wore off and that the client could walk and use the bathroom unassisted, urinate easily without a catheter, and hold down solid foods and beverages. Though the child was jaundiced, the client's child was discharged home after the child was treated for phototherapy in the hospital. The client denies any other post-delivery or early infancy problems with the child. She notes no respiratory challenges, apnea, seizures, stiffness or floppiness, infections, colic, or difficulties with feeding, though the child was formula fed with Enfamil because the client's breast milk never came in. While the client was offered hormone injections to facilitate milk production, she refused the procedure. However, she did comment that the Enfamil was quite expensive at $30 a can. The child's noted developmental milestones are based on both the client's journals of some of her guesstimations of others. The client noted that the child is left-handed and described her as having average developmental coordination. As an infant, the child began smiling at about 2 months, first rolled over 5 to 6 months, sat alone for the first time at 6 to 7 months, drank from a cup unassisted at 8 months, developed a pincher grasp at 8 months, first crawled at 9 months, pulled herself up to a stand for the first time at 11 months, and began holding on to furniture to move around the room upright at about 12 months. As a toddler, the child began feeding herself with her fingers at 13 months, began walking independently around 16 months, began scribbling with a crayon at 18 months, began pedaling on a tricycle at about 2.5 years of age, was potty trained by the age of 4, learned to tie her shoes on her own at the age of 5 in kindergarten, and learned to skip by 6 years of age. The child is currently 8 years of age in the 3rd grade, and according to the client, the child presents as age-appropriate with fully developed, healthy personality. She has no history of abnormal outbursts or associated temper tantrums, nor any history of enuresis, nightmares, thumb sucking, or pica. Additionally, the child is a good peer-to-peer interactions and shows appropriate respect to adults at home, at school, and at church. Thank you for your attention to this developmental history.